Sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D.
Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health, heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, for each day you'll find current medical news, knowledgeable guests, and fascinating health topics, and where we do encourage you to call in to join in. Today we're going to just open them up to you. I've got plenty of things to discuss with you on my plate. You may have a number of things to discuss on yours. Open phone day it will be today while I'm waiting for you to give us a knock on the door and find out what's on your mind. I'll be bringing you a couple of things to get off of my mind and convey to you. Of course, that number to do that, 412-825-6262. That's 412-825-6262. We introduced a number of important ideas this month, and none more important than one I will elaborate on a little more today. This issue of the fish oils, I think is absolutely a trend-setting moment here for our show, and I'm just loaded with more science to bring to you to help support that contention. Because as I look now, and I've been all over the internet, I've been looking high and low to find corroboration elsewhere, folks, it's just not there. I think we're pulling one off here. But I have the science to back up the statements I've made, the contentions that I've put forth, and science will win out, and you are one step ahead of the game. Anyway, if the show's on your mind, give us a call. If there's something else on your mind, 412-825-6262 is the number to do just that. As we look into the future, you're not going to want to miss Wednesday's show. It's going to be a follow-up, folks. The real brilliant folks in medicine are the scientists who don't really treat patients, but are in the lab and do the research and do the manufacturing. Those folks behind the scenes are really where the intelligence completely lies. They're brilliant folks. And we had one such brilliant individual on a week ago. Talking about Ed Kane. Ed Kane returns now with us on Wednesday. He needs to pick up where he left off. If you were left somewhat confused, I hope I was able to help straighten some of that out on Friday. And even today, I hope to be able to do the same. But believe you me, I do so with a lack of the acumen of an Edward Kane, and in particular, the acumen of his wife, Patricia Kane. These two, the doctors Kane and Kane, have literally set the world on its ear when it comes to neurological diseases and the treatment thereof. Very serious diseases, and I always thought an interesting component to these case studies that we continually observe as we're at the conferences, and we were listening to Patricia Kane being the wife of Edward Kane, and the real clinician, I guess, would have to call Ed the academician and Patricia the clinician. But when you see these serious cases going up of I call the big three: Parkinson's, MS, and Lou Gehrig's disease, amyotrophic lateral sclerosis, ALS, where there's nowhere to go in medicine with those three diagnoses. There really is no treatment at all. There may be, as I say, may, because I'm finding in the cases where we have discussed patients who were placed on these medicines, they didn't even get the supposed symptomatic relief that might be forthcoming by taking a drug. And in every case, the drugs that I know that are used to treat those big three, right in the literature that corresponds to each and every one of them, right in that literature it says that the disease may, and they use the word may, they say may actually accelerate the progression of the disease. Well, what in some parlance may be a may turns out to be in reality a usual, and unfortunately these diseases progress rapidly under that kind of treatment. I don't know whether the drug itself actually does that, or whether or not just lack of any effective treatment allows these diseases to proceed on course. But whatever it is, the conventional medical community, who does a great job in making the diagnosis, then comes through with literally no payoff when it comes to treatment, and they just tell you get your affairs in order. Anyway, the point I'm trying to make is, as many cases as I've seen that Patricia Kane has discussed during the seminars that I've been with her, there's that unique little portion of the case presentation when you get close to the end, after the description of how, when she met the patient, what she found, how far the disease, whatever one it was, had already progressed. Once she's made her assessment and plowed into the treatment of that disease, not using any pharmaceutical preparations whatsoever, no drugs at all, to find that most oftentimes one of the last phrases of that particular case is the diagnosis was withdrawn on a certain date. So to see a diagnosis of ALS when a patient had been told, look, you've got maybe 6 months to live, and we really don't have any treatment for this, to find out maybe a year or 2 or 3 later, when this patient is walking around and just resumed normal life, that the doctors who originally pronounced and documented the presence of a disease, for them to finally have to say the diagnosis is now withdrawn, as if to say, well, maybe we made a mistake with the diagnosis, and so we have to withdraw this diagnosis because it doesn't apply. That's the interesting piece of the Patricia Kane puzzle that I've had the benefit of multiple times now. I share that with you. Anyway, as an outgrowth of one of the very things used by the Kanes, Edward and Patricia, in these very fascinating cases, has always been the appropriate fats in the diet, and the manipulation and the alteration and the correction of abnormalities that exist within the patients that they treat with their fatty acid analysis. It's all fats, folks. That's the basic Patricia Kane protocol. And so if there are any two individuals literally in the world who have the ability to comment on the correctness and the incorrectness of dietary intake of fats, it's these two individuals. Anyway, Ed Kane be our featured guest on Wednesday. I've asked him, and you may have some additional points to raise, but I've asked him to talk specifically about arachidonic acid. You'll see why in a moment, but nonetheless, our guest on Wednesday, Edward Kane. You don't want to miss it. By the time Friday rolls around, we'll bring our good friend Jerry Singleton back. He should actually have a date for us. We brought Jerry with us on Friday to talk about MCG testing out there. Really, since February, multiple folks have taken us up on an offer for those who wanted to get an assessment of their coronary arteries and get that assessment in such a way so as to give them the information as if they had a full-blown cardiac catheterization without obviously ever having such a dastardly and invasive procedure, by just lying on a bed and having an electronic gizmo scan the body and is able to accurately predict what the status of the coronary arteries are with respect to how clogged up they very well may be. Now, no one's ever stepped up and said, could I please have a cath? Catheterizations occur when someone is in a pretty bad way. Usually they come to the emergency room because they're having pretty serious symptoms, and in that situation, it's the emergency catheterization that gets done in order to oftentimes locate an occluded or occluding coronary artery, and then they use the angioplasty and the stent placement and the like. To get that sort of a look-see at the inside of the coronary arteries is everyone's worst nightmare. Yet the information would be helpful, would it not? If you could actually know what the status of the coronary arteries were without ever having such an invasive procedure, would that information not be beneficial to you? Well, I think so, and many of you in the past have thought so also, and have taken me up on the offer for the MCG testing. We've now procured the device. We will have it here always, and so please excuse us for the brief lull in continuing with the MCG testing, but that lull has been due precisely because we were literally compelled to get the piece of equipment. Tough to get, too, by the way. Very tough to get, but we think that's much about it that we will have it here. And we'll have the dates in August. Now, Jerry gave us two potential dates, just to let you know. If you've already had MCG testing, this multifunctional cardiogram, which is what the MCG stands for in terms of the acronym. If you've already had MCG testing, and you scored either in the 3-month repeat or the 6-month repeat, we are coming up for both of the anniversaries, both the 3-month and the 6-month. So when we offer this new set of dates, it literally will encompass all those individuals in the 3 and 6 month categories. Actually, it's only 3 categories once you do the MCG testing. And based on the score, if you have shown a considerable amount of coronary artery occlusion, as evidenced by the MCG test, the insurer will pay for have this test done every 3 months. And certainly that was operational from the February group, February to March, in May. But then also with a little lesser of a score, indicative of more mild coronary artery disease, you would be able, in those cases, to repeat the test every 6 months. And so we've already had a discussion with every single one of you who have done the MCG testing. When we had that discussion, I let you know, based on the score, what it was in terms of when you'd be able to repeat the test. And so if you're in the repeatable in 3-month or 6-month category, your time is up. When I offer the dates, please call up the schedule. It's either going to be the 18th or the 25th. At least that'll be the first group. There'll be many groups afterwards if you're on a summer vacation schedule and that's just a rough month for you. Don't feel bad. In September, when things quiet down, you'll be able to resume this in a way that's much more pleasant for your schedule. So MCG testing will be coming up very frequently and multiple times in the near future. Other guests as we turn the page, and we will be turning the page this week. By the time Sunday rolls around, that's the 31st of the month. We then move into August. We'll have Susan Smith-Jones with us. She'll be here on the 3rd of August. She's going to pick up where she left off with her natural remedies. We inked a new guest over the Thursday, Friday section of time. You know him, Doug Inglesby, the vitamin man. He's going to be talking about low-cal diets driving you crazy. And then we have some other guests that we just haven't got their bio information, so I won't tell you about them. There'll be August guests. And then well into the future, September, way off into the future, David Brownstein returns to continue to talk about salting your way to health. So that's the way it shapes up right now. We got a knock on the door. Come on in the store. Hello, and what's on your mind? Anything I can help you with? Go right ahead.
Hi, Dr. Courtney. I have about 3 questions for you regarding the fish oil controversy.
Oh, it is a controversy, is it not?
Shall we call it? The first is, what do you say about, a lot of natural doctors, they say there's way too much omega-6 in the American diet already, like in the baked goods and the breads. And so I guess the idea of the fish oil was to kind of getting more omega-3 was to kind of counterbalance that. But, if you're taking like the oil in the correct, 4 to 1, what about then the rest of your diet where you're getting too much 6?
Very great point. In fact, it made such logical sense that I think that's how the fish oil story really took shape and took form, and then it made such logical sense that even the conventional medical community bought into it, and then we got this new substance called Lavazza, which is a prescription form of fish oil. Be that as it may, even though you have a disturbed ratio, and it's true, you're overly abundant in our diet of omega-6s. We have way too much omega-6s and not nearly enough omega-3s. And it was felt, well, what we need to do is, as you mentioned, we should bring in a very potent source of omega-3s, and the body will work it out. Turns out, that's not the way the body works. It makes sense, it makes logical sense, but if you want to change the complexion of your fatty acid composition, you have to supply the raw ingredients in the right proportion in order to have the changes take place. And that's a completely different thought process than this logical, and as you presented it, extremely reasonable way to say, hey, our diet's so overburdened in 6s, if I just bring in the 3s, well, that cancels one out over the other, and I should be like in the middle where I want to be. Doesn't work that way, and I think that's a great point to bring up, a great revelation. I promise to bring that point up to you with Ed Kane on Wednesday, and we'll let the scientist answer it. Hopefully he'll do it in a way he won't confuse both of us, but I think I've answered it in a simplistic way. You can't counterbalance your omega-6s by taking a potent source of omega-3s. It does not work out that way. Next question. You said 3?
What about, how they say in the flax, like when you get it from the vegetable, the flax, it's not as much the omega-3 is converted out of that. Like, that's not a concern? I know I need to, I go into AFib when I don't get, well, put it this way, I had problems with AFib for about 20 years, and then as soon as I started taking the fish oil, I don't have it anymore. For about 5 years now, I haven't had it. So, I'm real concerned about making sure I get, enough omega-3.
Absolutely. Well, you did pick, it seems like you have taken flax oil. Am I right about that? You're taking flax oil as your supplement?
No, I start with the fish oil, yeah.
Okay. Well, the flaxseed that you do mention is the representative component. Now, in Dr. Yehuda, we all have to pay homage to this fellow that nobody seems to know about. I mean, who really ever heard of Dr. Yehuda? And I bring this up in the scientific world all the time, and they never heard of him. But he's the guy back in 1994 that came up with this ratio of 4 to 1. That's his ratio. The fact that, by the way, others appear to know about this ratio. I hear other colleagues of mine talk about a 4 to 1 ratio. At least that number is out and about in the public. It doesn't appear as though they know how it got there, but I'm telling you it got there by the work of Dr. Yehuda. And then not only did he spell out the ratio of omega-6s to omega-3s, that is your 4 to 1 ratio. And so the first surprise is you need more omega-6s than you need omega-3s. So you're not as far out of balance as you might think that you really are, okay? But the second thing is, not only did he tell us what the ratio is, he spelled out what the oil should be, what the fat should be, and the omega-6 fat, the 4 part of the 4 to 1 ratio, should be linoleic acid, and the best representative of that is either primrose or sunflower oil, and then the representative of the 1 part of the 4 to 1 ratio is alpha-linoleic acid, and that's best represented by the flaxseed oil. So there you go. Thank you, Dr. Yehuda. You figured out there's a ratio that you have to follow. Not only did you figure out there's a ratio, you gave us the actual oils to use to make certain that if you're going to supplement, that you use these representatives. There's plenty of omega-6s and there's plenty of omega-3s. There's bunches of them. But to settle on these two took scientific study, and I tip my hat to Dr. Yehuda.
So we could mix that up ourselves, right? And
you absolutely could. If you had the the raw ingredients of flaxseed and sunflower, and you wanted to go mix it up, I don't see why it would work any different. In fact, that's another question I'd like to ask Ed Kane when he comes here on Wednesday. But yes, you could.
Because I noticed that it comes. The product he sells comes in a capsule and a liquid, the bottles.
Yes.
So if you wanted to take the liquid, which of course if you made up your own, do you know how much he would advise, like several teaspoons or several tablespoons a day?
I'm holding a product, by the way. You mentioned it. This product at Body Bio that Ed Kane is the president and CEO of the company. Now, back in 1993, they didn't have a product, okay? Yehuda comes out with the article in 94, and they're elated, and that moment, he didn't wait for other scientific backups on repeating the study. He just jumped full body into this into the product realm, and he developed the 4-to-1 oil based on Yehuda's work. It does come in a liquid, as you do mention, and comes in capsules. It is organic, and it is a combination of sunflower and flaxseed oil that we're talking about. In terms of, what were you asking about the product now?
If I just mixed it up myself, how much would I take a day as,
Oh, the dosing on, if you were doing nothing more than having a supplemental regime without any medical problem going on, right here on the label, you just take 1 tablespoon a day.
Okay.
1 tablespoon a day, and that's all you need. Now, of course, if there are medical issues, and then when I say they, I'm talking about Patricia and Edward Kane, who end up treating a lot of folks with serious problems. Once the fatty acid analysis comes back, and they determine and they then know what your fatty acid status is, they may require a much greater amount of 4-to-1 as well as other fats in order to treat it.
So it's good to be tested so you know what you're doing.
Well, if you're feeling wonderful, it's pretty tough to justify such an expensive test, okay? But it is out there, and you could know it. If you have any medical issues at all, and especially ones that appear not to have an answer for, many folks do. They're very disenchanted with their medical manager because no matter what their doctors tell them, they don't appear to ever get better from the problems they have. If that kind of medical situation is operational, then it's justifiable to get the fatty acid analysis. You will then see the disturbances of the amounts of fats, and it won't be just flax oil and omega-3s. There's 40, 50 different fats that get reported out when you get a fatty acid analysis. And I can tell you that the premise by which Ed and Patricia Kane do their treatment protocol is to put into balance all 50 of them. In other words, you may be too high in some, you may be too low in another. Their objective will be to hit the happy median and that you have the right amount of all 50. And that takes a little bit of doing, but nonetheless, it gets done. And as it gets done, these symptoms gradually improve and the diseases go away to the point where patients with ALS, they say the diagnosis has been withdrawn. That is unbelievable.
Wow. Yeah, because you think something like ALS would be caused by so many other things, like toxins in the environment.
Absolutely. By the way, they are the precipitators. They are the precipitators that make the fatty acids go completely confluent in the various ratios. So you are so right. The toxic exposures of one's lifetime absolutely can be the predisposing factors that allow this mishmash of fatty acids to go so far askew that the membrane can't function anymore. It's the fatty acid content within the cell membrane that determines how well a nervous impulse will be propagated down the nerve, which is located right on top of that membrane. And if the fatty acids are disproportionate, the impulse can't travel. The symptom will be, I can't breathe, or I can't move my arm, or I am weak, or I have no muscle tone. Well, that's the symptom, but why do you have that? Because you can't propagate a nervous impulse at all, and it's the fatty acid contents that so far askew that will have to be brought back into balance, and the things will function again. Anyway, that's the premise, and it turns out to actually work.
Now, you can order, can you order the fatty acid analysis for your patients?
Oh, I certainly can, and as had been mentioned by Edward, and he'll say it again, there's only one lab in the world that does this job in the way it needs to be done. It's at Johns Hopkins. The Body Bio, as a company, actually has now a contractual relationship with Johns Hopkins, and so all the doctors that I commiserate with that go to these conferences, we are able to directly connect with Johns Hopkins and send the blood test there, and it can and will be done. And then we'll get reported back what the fatty analysis is, and know where to go from there. Once you know where it is, then you know how to treat.
Do you know if any insurances pay for that test?
There are, as we always find out when we go to these conferences, yes, there are insurance companies that do reimburse, sometimes completely, sometimes partially, yet no, I couldn't tell you if yours does or does not. But there is, because it's a legitimate lab at a pretty prestigious institution. This isn't anything alternative at all. This is highly sophisticated and literally not producible any other place other than Johns Hopkins, because they haven't given the effort and the personnel. But at Johns Hopkins they have, and that's why it's done just there. But the fact that these are legitimate medical tests allow for it to be covered and oftentimes forward.
Would I be a candidate for that test, being as I have a long history of AFib without the right FAST?
You absolutely, if a patient came in and they actually said to me, look, I'm feeling good, I really don't have anything wrong with me, but I'd love to know what fatty acid content in my body is, because I'd just like to have the right supplement regime. That alone would allow for the test to be ordered.
Okay.
So if somebody has medical issues, and you apparently do, you for sure would qualify. But there are those out there that are proactive, and they go, oh, hey, I want to know what to take and how to take it and what I'm lacking. Could I know this? And the answer is absolutely. The test is allowed to be performed as long as it's written as a prescription by a medical doctor, in which case I'll be more than happy to assist them too.
Okay.
Okay?
Could I ask you one more question?
Oh, we're doing so good. Maybe everybody's benefiting from this conversation, I hope. Go right ahead. What's on your mind?
This is about the flax oil. Now, I know all about the Budwig protocol, how she used the flax oil,
with the cottage cheese
for cancer. But somewhere in the past, couple weeks, I don't know where it was, if it was on the radio or I read it, some warning about use the whole flax seed, and grind it up. They were connecting the flax oil with cancer. And I don't know, did you ever hear anything like that?
Boy, as much as I scour, and I do scour the blogosphere, pretty tough to think that something got by me. I don't remember reading this one.
Okay.
So you came across something. Please pass it on to me if you have the opportunity to do so. But
okay.
I'm not familiar with that. That Joanna Budwig, by the way, who I don't know personally, but and she has since passed on. But interesting thing that came up about her, you evidently know her protocol for cancers. So to the extent that you've heard of Joanna Budwig, you're ahead of many others, our listeners who may not have. But this is a brilliant scientist who, besides being a biochemist and biologist and a whole bunch of other degrees, later in life decided to go become a medical doctor besides. But interesting enough, Ed Kane knew her very well. And he talked about a story. I'll pass it on to you now and the listeners because it's rather humorous. This rather brilliant, eccentric lady was giving an interview to some reporter. I don't know from what country even the reporter was, but there was an interpreter. Joanna Budwig is German. Her native language is German. And she probably is multilingual, and who knows if she really was or not. But during the interview, the interpreter evidently wasn't translating it the way that Joanna was saying it, and Joanna got so upset with the poor translation that was being done by. So she obviously had to know the other language well enough to know that the interpreter wasn't doing the job. She took her cane and seriously beat the translator with her cane. I wouldn't say to a bloody pulp, but it just shoot her out of the interview so as to not interfere with the dialogue. And picked up from the interview on her own without any help from the translator at all. I think that should be noted. I think you should be aware that Joanna Budwig was that eccentric that if she felt things weren't going right, she jumped in and she took charge and seriously beat up on a translator who wasn't doing the job well. There you go. There's a little bit of inside baseball for you.
Some people have been, I guess, from reading her literature, have been eating the cottage cheese and flax oil like every day as a preventative measure, including, I saw the talk by Bill Henderson up at the Days Inn in Butler, and he said he ate that every morning for breakfast. But now, in light of this new information, it would be good to eat the 4-to-1 oil with the cottage cheese.
Well, I mean, if you'll listen to Ed, and I promised to ask Ed to speak a little bit about Joanna. I've got a little list going here. I don't know if we're going to accomplish it all on Wednesday, but I promise to bring Ed back until we do. But in the case of Joanna's work, and she was so far ahead of her contemporaries at the time, people gained quite a bit of benefit from what she proposed. The problem with Joanna Budwig's work, as well as every other serious contributor of that era, is that people did benefit to a point. They did get great results to a point. And then when that point was reached, the improvements rapidly fell off. And the reason for that was that Joanna Budwig was not familiar with the 4-to-1 rate. It wasn't known. Had it been known, that brilliant lady would have come up with a way to meet what science had to offer than what could have been at that time. And maybe she would have come up with a different way to treat cancers that did not have the unsuccessful component, because she certainly had tremendous successes up to a point. And I think therein lies the rub with all of the research that we have about fatty acids and all the protocols that have been out there utilizing fats, is that without this knowledge of 4-to-1, it was destined to have its failures, because it couldn't ever be perfected until the 4-to-1 information was finally revealed. So there may be a lot of people doing the flaxseed and the cottage cheese, but it would not be the appropriate way to proceed. The best way to proceed is use the 4-to-1. That is the best scientific ratio.
I wonder if the cottage cheese would help you absorb the 4-to-1 like it did the straight flax.
Well, I'm going to ask the guy who would know about it better than anyone else, and that would be Ed Kane himself, and I promise to ask about the Joanna Budwig protocol on Wednesday. Okay? You want to stay tuned?
Yeah.
Great dialogue between the two of us. I hope everyone benefited from it. I feel that this is the kind of dialogue that helps clear the air. We've come in with scientific, this is dynamite, folks, because nobody else seems to know about it. You, as listeners, are being brought into the ground floor of information that will not change. You have information at your disposal that you'll now use in your best interest, as well as spreading the word, but it appears like nobody else knows. And yet, it is scientifically known. It will not change. It is what it is, and it will be proven to be correct well into the future. You just heard it first here, and I'm glad to be able to bring it to you.
Okay, thank you, Dr. Courtney.
Absolutely my pleasure.
Bye-bye.
Mm-hmm. Great dialogue. Wear the information well. Let's do this. Let's take a short break. In the interim, you may want to come back here and ask a question on your own. Can be about fish oil if you'd like. Doesn't have to be. Anything on your mind is okay with me. We'll return in a moment and have at it some more.
Honey, just got the word. The company's new health plan has a $5,000 deductible. We have to make sure nobody gets sick this year. Remember what those doctor's visits cost for last year's colds and flu? Oh, sorry, I've got to go. Love you.
We can do this. We can cut the fast food lunches. Soda, that's a lot of sugar. We could all take that evening walk. And hey, I heard a program about fruit of the spirit. What did they say? 1 ounce, the equivalent of 5 servings of fruit with herbs and minerals. We could add some to our breakfast protein shake. Fruit of the Spirit is unique whole fruit puree. Fruit of the Spirit contains fresh fruits native to the Holy Land and alkalizing minerals from the Dead Sea. With no added sugar, Fruit of the Spirit's unique product from 5 years of work from science-based nutritional experts. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. Fruit of the Spirit, convenient, affordable, and delicious. That's 1-800-442-3793. Call them now, 1-800-442-3793.
Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instructions, it just doesn't quite produce the results that you were looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, M.D., is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Hey, good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard here in KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today in this Monday version of the show. Hope you had a wonderful weekend, folks. And if you want to keep tuned to KHB each and every day, especially on those Monday, Wednesdays, and Fridays, we're smack dab in the middle of what appears, on the one hand, to look controversial. Actually, science has weighed in. It's not controversial at all. It's only if you don't have this information and it flies in the face of what you previously have believed that it could appear to be controversial. But controversy is done. Anyway, we'll continue to bring this information on the fish oil story, as well as, remember, the adage has been, first to bring it to you, taking fish oil. It will be, not can be, will ultimately be hazardous to your health. We open it up to you today. We say if you got anything on your mind, you want to get it off your chest, 412-825-6262 is the number to do that. That's 412-825-6262. We've got a knock on the door. Come on in the store. Hello and welcome aboard. What's on your mind?
Good morning, Dr. Courtney.
Hi.
Hi. I read in the information for Armor Thyroid and Cytomel that if you have adrenal insufficiency, that you should not start this medication because it would create increased demand in your body for adrenal hormones, which would actually make you feel worse. I was wondering if that was correct and if you could speak about that at all.
Yeah. With respect to the use of T3, it is, and that is the Cytomel is straight T3, and Armor is a combination of T4 and T3. Okay, it's a 50-50 combination.
Right.
Anyway, the way the conventional therapies have worked, very few of my colleagues ever move outside of taking the of prescribing the Thyroid regime, which is synthetic T4. And believe you me, I've heard all these adages about, why you shouldn't use anything other than T4. I've just found them to be completely incorrect. I think that what you have to come down to say is this: whatever amount of thyroid hormone that you require that is biologically causing your cells to work properly, that is the correct amount of thyroid hormone for you. And if in fact you had an individual, and I'm going to hypothetically say there's got to be somebody out there that actually benefits from Synthroid, okay? There's somebody out there that does. It's very rare, but it does. And if they got levels of the T4 that were in abundance to what they actually required, I think that they could have adrenal consequences to taking what would be a drug that they just had too much of. So I can envision how, in a rare case, taking Synthroid could be harmful adrenally if the dosing was way too much and it was inappropriate. I'll take that same defense and way of thinking to the other two components of thyroid treatment. The second would be farmer thyroid. A 50-50 combination, naturally derived, comes from pigs. And if this particular substance, which I believe is much more biologically active, is in amounts over and above what you require, I believe there are adrenal consequences to that. It has to be an amount over and above what you require. So the key is coming up with your dose. And then that same way of thinking needs to be used when prescribing the T3 only. Appropriately, you mentioned it, it's called Cytomel. And once again, there is an appropriate dose of Cytomel or T3 that your body would function well on, and if it were provided to you in amounts over and above that, you can have adrenal consequences. In all three cases, it's the amount of the substance that leads to the adrenal consequence. You cannot justify having a lesser amount of thyroid function for fear that it would interfere with the proper adrenal function. Doesn't work that way. Have I explained my answer at least the best I can?
I think so. What you're saying is that of all those two medications, if you take too much of it, it'll suppress your adrenal function.
Absolutely. If you have super amounts of thyroid hormone over and above what you require, it's going to have ramifications in all tissues. Forgetting about why you just mentioned the adrenal for conversation purposes is fine, but you just picked the zip code. There is a consequence to pay for an over amount of thyroid hormone, no matter what three categories of drugs you pull them from. If you have the right amount, if you have the right level of thyroid hormone functioning for you, then you do not have to worry about these adrenal consequences. And I feel that my colleagues have read what you read, and they go, oh my God, I could never use that Cytomel or that T3 or that Armor for fear that it would cause adrenal shutdown. Well, wait a minute. You can't ignore the thyroid that isn't functioning correctly. You must bring that up to snuff. It's the key gland. It's the number one. It's got to work optimally, and as long as it's working optimally, you have no fear of any consequence in other areas of the body, adrenal or otherwise. And so that's how I'll answer the question. And by the way, I follow that up with how I actually treat patients on a daily basis. We're going to whatever that patient requires to be their optimal dose. And I'll tell you this, there's such a wide degree of variation out there that I have some women of hundreds that I treat right now who are established on a dose of 2.5 micrograms of this T3. Okay, that's a very low dose, but these women are doing extremely well with that low dose. On the other hand, at the other end, I have some ladies who are on as much as 230 micrograms of the same medication, and they're doing fine. Look at the wide swing there is out there. 2.5 on one side 230 on the other. My goodness gracious, you have to continue to move ahead until you hit that optimal dose. What I've learned in my medical training that just doesn't work is you just can't put a person on a dose of anything and say, here it is, and you're on this for the rest of your life, and you don't alter that or change that dose to find optimal. You're destined to fail, and it's pretty clear in the area of thyroid treatment, that's where the profession comes in. They are failing every day because people are put on a dose, they're left on it. Some lab work swings, the doctors feel very good about what they're doing, but the patient still feels lousy because they haven't achieved the right dose for them just yet. I hope I answered your question.
Yes, I think. Thank you so much. I just had one other. Can you just take Cytomel by itself? Do you have to take it with Armor?
Oh no, you actually would never take. In other words, the clinician has to decide how he's going to approach the problem, and he's going to have to select, he or she, is he going to use a Synthroid straight T4? Is he going to use a mixture of T4 and T3? Or is he going to use a straight T3? You don't change, you pick one of those and you go with it. But you don't dabble between more than one. You don't do some Armor and some T3. And the reason that you don't do that is because the half-lives of those are so different that you could not maintain a drug level of any medically provable way that would be optimal for a patient and not knowing that you could harm them. Because on the one hand, you're dealing with something that has a half-life of 24 and 36 hours. The Cytomel only lasts 4 hours. Now, how you ever work with those two products is beyond me. And I think it's so mind-boggling. I'm glad I've never gone there, and you never should. You pick one way to use it now, and even if you're going to use Synthroid, then use it till you find out the right dose, and if you can't get the right dose, switch. But this is not how this is done in the medical world. They pick a drug, they put established doses out there. Let's say if it's going to be Armor, they put you on 1 grain. And and that's where you stay. And you just stay on 1 grain forever. Well, that doesn't work, folks.
So Cytomel,
Cytomel is the pharmaceutically manufactured form of T3. The problem with Cytomel, as I see it, is that it only lasts for 4 hours.
And I just had one. I don't want to take much of your time. I just had one quick question. Do you prefer the brand or the generic? Or does it matter?
No, here's what I prefer. I don't prefer establishing anybody on a medication. By the way, I don't think taking a hormone is a medication. If you need a hormone, doggone it, then it's something that you require because your thyroid's not working. So it's not a medication really. It's a hormone you have to have. But what I say about taking these drugs is I can't justify putting somebody on Cytomel and consigning them to taking a medicine 6 times. If the drug only lasts for 4 hours and you want to maintain a constant drug level, what you're saying is this isn't something you have to take 6 times a day. Who in their right mind wants to take anything 6 times a day?
Yeah.
So the way that you compensate for that is you get time release. You have to get it compounded. So you get the Cytomel, the straight T3 compounded, the best the compounding can offer us today. There's no such thing as a 24-hour time release. There is no such thing. But the best they can do is a 12-hour time release, and so that's what we use. And women will take and not be upset with you taking something twice a day. They'll do that. But I'll be doggone if they or anybody else would take something 6 times a day.
Right. Well, thank you so much for explaining that. I really appreciate it.
I hope I helped you out.
Very much.
Okay, absolutely. Yeah, got to pick one of the 3, folks. But then what you have to do is you got to keep increasing the dose to find the right dose for that patient. Just remember, some ladies, 2.5 mics. Others, 230 mics. Goodness gracious, how would one ever know how to come up with the right dose unless you continue to push the envelope to ultimately achieve that level? Hey, we got another knock on the door. Come on the store. Hello, welcome aboard. What's on your mind?
Hello, Dr. Courtney.
Oh, yes.
Yes, sir. How you doing there?
I'm doing well. How can I help you today?
Hey, listen, I hope I have an easy question for you. I just want to say you're doing a terrific job. Even if people were tired down to church, they all listen to you.
Ah.
We want to thank you directly for how good a job you're doing for a lot of our old people, because you cannot get that help.
Well,
When you went to a doctor and paid for it, you never get the advice that you're giving it. So we really appreciate what you're doing.
Thank
Keep up the good work.
Well, thank you
So
so
listen, I
much.
hope I have an easy question for you. My wife has sort of an irritated eye, inflamed to the point that it's a little bit red. It waters once in a while, and because it waters naturally, the vision itself is not clear. Now, would that have any connection whatsoever either to humidity and or arthritis? She has arthritis pretty bad.
Well,
Would arthritis get in the eye and irritate something like that as far as the redness is concerned?
well, you know, there's actually a form of arthritis that has a keratoophthalmic distribution. Kerato meaning cornea, okay? And so when someone has a red eye, this is usually talking about the structures of the eye that are most exterior. And the cornea it's the outer shell, clear shell of the eye. And in inflammation of the eye, keratitis is usually the cause. So to the extent that we're talking in hypotheticals right now, could a person who has arthritis have a form of arthritis that can involve the eye? The answer is yes.
Well,
Now,
why would it be, doctor, it only affects one eye?
I absolutely think that is a query that it wouldn't dissuade a doctor from making that diagnosis. It doesn't have to involve both eyes.
I see.
In fact, maybe that's even more so in favor of having an organic connection as opposed to not. But really, she does deserve to have that evaluated to find out if, in fact, because this is chronic. It seems like it's been going on for quite some time, correct?
It has, yes.
Okay. So what's fair here is to make sure that she gets an ophthalmological evaluation. And in a matter of 5 minutes under the right hand. Certainly, I don't feel that those are my hands. I don't have an ophthalmology background. But plenty of eye doctors out there could make the diagnosis, and they could put together the combination of arthritis and eye if it needed to be made. That could only be made by certain blood work that have to be done, showing certain presence of antibodies in the body. Okay, but there's a way to proceed. Now, when that's all said and done, and you have the right diagnosis, then I think I need to see you, because being treated with steroids, which is probably the way it's going to be handled, wouldn't be the way that I'd look to be treating it, okay? But to make sure you get the right diagnosis, get the professional input, find out what the treatment is. Unfortunately, I've got a feeling that it's not going to be, unless it has a resolvable problem, like a microbial problem where there's bugs involved, I got a feeling the long-range treatment involving steroids of some type is not a good one, and then we'd have to discuss how best to deal with that. But I wouldn't feel comfortable just taking that one on without having an ophthalmological evaluation first. So why don't you start there?
Okay, well, is there any way that you know that if they give you some kind of an eye drop or something like that, can you just ask them without getting them excited that if this is a steroid, I physically don't want it?
Oh, see, unless they feel it was microbial, and even when it's microbial, if there's an irritation, many of the ophthalmological preparations contain the antibiotic and the steroid right in the same doggone substance. The two are mixed together. So, on the one hand, don't run away from steroids on a short-term basis, okay?
I see.
Yet, in a chronic case, as you described, a long-term use of steroids is not a very good idea ever.
Okay.
So,
if you go on that short term, how long do you feel wise, day-wise or week-wise, to take the irritation away?
10 days. 10 days. I say that the use of, I've got, I use this kind of preparation all the time. I prescribe it. I don't shy away from it, but to use it for 10 days, 14 days, This is why an acute situation can be quieted down. I've seen a lot of people who wear contact lenses. They sleep in their contact lenses. Literally, the contact lenses get stuck to their eyes. By the way, contact lenses are not supposed to contact the eye at all. They float on a tear layer. So if they sleep in them, they actually adhere to the eye and get really irritated corneas. I don't hesitate to use a steroid preparation in that particular case. Yet 10 days later, it's done, it's over with. That's an acute problem that has an acute resolution. The description you give me of your wife appears to be a chronic problem, and whenever there's a chronic issues going on, the long-term use of steroids is not advised. So, got to get a diagnosis first, sir, okay?
Okay, well, listen, Doctor, I appreciate your help. Take care of yourself, too.
Absolutely. My
Thank
pleasure.
you,
Mm-hmm. All right. Enjoyed these questions and answers today. I've got a couple minutes left, by the way. If there is going to be another knock on the door, I'll let you in. 412-825-6262. Looks like we're right at the end. Look, pay attention on Wednesday. I think you'll enjoy having Ed Kane return. I've jotted down a number of questions to fire off to Ed. He truly is the scientist that can answer them. I'm going to be asking about the Joanna Budwig cancer treatment. I know that came out today. Going to further ask him about Dr. Yehuda and that 4-to-1 work that he is so famous for from 1994. You can give us a call, too. Don't forget, Wednesday, 412-825-6262. We'll pick the fish oil controversy up. When we return, you've heard it first here, folks. So long.
Impact on Your Health is sponsored by Dennis J. Courtney, MD, Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, MD.